Hello, 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 and welcome to another episode of Owning Pleasure as a Black Woman. I am super excited to have you here today because this conversation is one that y'all have been asking for. But before we get into that, let me welcome you correctly, okay? For my new listeners, thank you so much for being here. I hope that you get everything you need when it comes to your pleasure, your self-care, and your rest. And I hope that you do take the time to go back and listen to over 100 episodes of helping you get there. And for those of you that have been here with me from the beginning, I appreciate y'all. I want y'all to know I appreciate y'all from the bottom of my heart. I can't even talk right. That's how much I appreciate you. Now, I have a guest for y'all. She is a friend of mine. I love her dearly, and I think this is a topic that y'all really want to hear because I understand who y'all are. I understand what's going on, and so I thought it was necessary to bring her in for us to have a little conversation. Now, before we get started, I want to offer you something that's going to change how you think about self-care forever. Okay, I've created a free 7-day self-care reset specifically for women who are tired of feeling guilty every time they prioritize their own needs. This isn't about adding more to your to-do list. That's not what I'm trying to do for you. It's about transforming that voice in your head that says taking care of yourself is selfish. You can grab it right now at jrewellness.com/reset and start your transformation today. Now, let me introduce you to our guest. Let me introduce you to her, okay? Dr. Taniqua Miller is a board-certified obstetrician gynecologist with a special focus in midlife menopause health. She received her undergraduate degree in psychology at Yale University after completing her medical degree at Harvard Medical School. She went on to complete her residency training in obstetrics, y'all, whatever, obstetrics. Y'all know what I'm trying to say, and gynecology at the University of Virginia in Charlottesville, Virginia. After 14 years of clinical practice, Dr. Miller took a step back from clinical care to center herself and her journey of burnout. She tells her own story of professional burnout to empower other women over 40 to overcome burnout by taking the leap into entrepreneurship through her I'm clearly on one. I'm on one today, okay? Her proprietary coaching framework, Burnout to Boundless. She is a wife, mother of 3 children, and the founder CEO of the game-changing telehealth platform Revival, which centers the voices and experiences of BIPOC people experiencing the menopausal transition. And she is in the process of opening up an actual brick and mortar, which I cannot wait to go visit because I know it is going to be beautiful, and I cannot wait to send my clients there because I know she's not going to skip on the comfort and the vibe and the energy, and she's just a vibe. So I hope you enjoy this. I want to know all about what you got out of it, so I want you to make sure that you comment below. Also, before you get started into the conversation, go ahead and rate this. Give us a 5-star rating so that this podcast can continue to reach those out there that deserve and need to understand the importance of their pleasure, their self-care, and their rest. So sit back and enjoy the conversation. Bye. Taniqua, welcome. Dr. Taniqua.
I know it's Friday evening, so maybe I'm just tea.
Right. This has been a long time coming because I think it's been a minute since I was on your podcast.
Yes. Which, by the way, was the most downloaded podcast of Midlife Revival.
Really?
Mm-hmm.
But that was a really good conversation. And I think this one is going to be similar because we were just chatting.
We should have pressed record earlier.
Right.
But we here.
I do believe that this one is going to be up there too, because when I look at the age range of my listeners and followers, the age range is from 35 to 55. So this is
wonderful.
A conversation that I hear people talking about all the time. Actually, me and one of my directors was talking about it today. So we are going to talk about perimenopause, menopause, health concerns, sexual health, whatever comes from the conversation. Whatever comes.
All of the above.
Right. So first, I think people need to know, how did you get into this? Like, how did you decide this is my specialty.
Yeah. So, okay, let me give you my professional intro, right? So, I am Dr. Taniqua Miller. I am a board certified OBGYN by training, meaning that I intended residency for OBGYN, so obstetrics, delivering babies,
Hmm.
gynecologic surgery, office practice. And I started residency back in 2008 and finished in 2012. So, about 15 years or
Hmm.
so. Did I do that math right? In
I was gonna
terms of
say, yeah.
being in practice.
Uh-huh.
And so I am a girl from New York. I'm a little girl from the Bronx, baby T, right? And I was always that curious child pulling off the encyclopedia off the shelf, right? When we had
Oh,
encyclopedias.
they'll never
And I
know
was
about the
they
encyclopedia.
won't ever know. Well, we know, right? Date yourself. But really, just fascinated about the body, but particularly in my identity as a little girl. I grew up in the housing projects, and I used to hear the teenagers say things like, "Oh, he said he don't want to mess with me because I'm a project girl," and not really fully
Mm,
understanding that and how girls, we call it now, we have names like the adultification of girls, like that they're
right.
hypersexualized and all of these things. And I just never identify with that. I always saw being a girl, a woman as a place of empowerment
Right.
because there were nothing but matriarchs around me. So it's like, how, if we are running things, right? And I don't know if my young self really had the words to what I was feeling, but it's kind of like we have these mothers, these aunties, these grandmothers who are basically holding down the community.
Hmm.
Like, why would sex? Like, that's what kind of is the downfall kind of thing. So I've always been interested in women's health, empowering girls and women through their reproductive transitions. And so it made sense that I would do that through obstetrics and gynecology. And very frankly, my name is Taniqua. You know what you getting when you see my name on a flyer or on a podcast episode. And so I wanted other little girls just like me to see themselves represented at the highest level of expertise and excellence. And
Mm.
so here I made my journey. I'm double Ivy League. So I went to Yale for undergrad and I went to Harvard Medical School, had wonderful, wonderful training, and ended up doing an OBGYN residency. Residency was challenging,
Hmm.
as it is, right? And didn't really actually know a lot about perimenopause and menopause other than kind of like your typical lecture, seeing a
Right.
couple of patients here or there. But my training was really focused on really good obstetrical care. Makes sense, right? I had 4 years to make sure that no one died, right? And then
Right.
and then gynecologic surgery, being able to remove parts or do surgery without harming people. And that was the focus of my training. And so when I finally got my big girl job and I joined an academic practice, an academic medical center, and I started seeing patients, a lot of your practice actually is focused in the office setting. So kind of when you think about your typical going in to see your GYN for your pap test, that was a
Hmm.
lot of my practice. And I started seeing people that were outside of needing surgery and outside of obstetrics. And I started seeing folks who were 40s, 50s,
Hmm.
feeling like they were losing their minds. They were feeling
Yep.
really anxious. They were having a lot of like relationship discord. And sometimes weren't even saying symptoms like I'm having hot flashes. They just felt like crap. They didn't feel well.
Yeah.
And so there was one particular patient that came in to see me and had a heart attack. So she was referred over by our women's heart center. And just something, I'm very like personable. Just something in that visit was off. And I was just like, let me put this pen and paper down and like have a heart to heart. Like, I don't know what's happening right now, but there's something off. What's going on? And she told me that she herself had been on hormone therapy. She was on oral hormone therapy. We could talk about kind of like some of the nuance of treatments. And she had a heart attack, right? So she was taking off everything. It is a contraindication. And she felt terrible.
Mm.
And she felt like she really couldn't advocate for herself, right? Because she had a heart attack, right?
Right.
You don't have a heart, you're not living. And her doctors were very focused on her heart health, but they
Yeah.
weren't focused on her whole health
As her as the person.
as the person, realizing that, are you not looking at this lady when she walks in? Something's
Yeah.
off with her. And I remember just pulling out something randomly that I remembered from some lecture somewhere, and I started her on it. And when I started her on it, she came back 4 weeks later and was like, oh my gosh, like lipstick sign bouncing in the office. She felt
Oh.
better. And, I thought about that and I was like, this little intervention, which was a generic medication that's old, probably cost her $3 at her pharmacy, really made a difference in her quality of life. And I was scratching my head over it. And that was unacceptable to me, especially, I'm a high achiever.
Mm-hmm.
So that's when I started really making an effort to understand menopause physiology, really understand what is happening. I knew it like conceptually, I know the
Mm-hmm.
definitions, but really how does it show up? And when you understand how it shows up and what's physiologically happening, then you're like, okay, we can address the symptoms of that result in a more effective way. And so became involved very early on with the what's now called the Menopause Society, very early in my time after residency, and then became officially certified in 2016. So that was about 3 years after I joined the society that I actually received certification. And so I've been practicing in the space of menopausal health since then. Since leaving my academic role, I exclusively care for people in the perimenopausal, menopausal transitions. Obviously, I'm still an OBGYN, so I ask when my people call me like, okay, girl, tell me about the first trimester, blah, blah, blah. I can answer those questions too, but primarily my focus are like your listeners, honestly,
Mm-hmm.
to help them navigate the transition and not just navigate the transition to get through it, but really seeing it as a new opportunity,
Mm-hmm.
a new
Mm-hmm.
opportunity. It is a huge neuroendocrine shift. I tell people you are not the same on the other side of this.
Right.
When you see those ads where like it's a lady's like, we don't care anymore. But
Yep.
like you turn 40 something years old and you're like,
Yeah, there's a lady on TikTok and her series is things we don't care about after 40.
yes, yes. And I think that it's age related, right? Like we just talked before we hit record on like the U-shaped curve of happiness that especially
Mm-hmm.
when you're in the 40s, you're at the bottom of that curve and it does go up, but but what is going to be the slope of that curve? Like how are
Right.
we going to have it go up? What new ideas and systems that we're creating in our life, rituals that we're creating to care for us? You're big on rituals. I still talk about that hand cream exercise you had us doing. And really not seeing it as an end, but like a beginning for the next chapter. You're going to spend a third of your life in this post
Mm.
menopause state. How do we really optimize it and make it the best third of your life?
Wow. And I love the fact that we are aligned in helping the whole person, right? Like it's nothing for someone to come into our practice and say, "Well, I'm having these sexual issues." Great, you're having these sexual issues,
Yeah.
but like what led to that?
Hmm.
And some people get frustrated when they come with a thing
Yes.
and it's like, but you have to understand the lay of the land, like lives.
Lifes.
And if we don't look at the
It's
whole
very
scope of
hard.
you as a person, more than not, we're gonna send you out there. You're gonna do the same thing in a different area of your life. So we need to be able
Hmm.
to look at all of it. So I appreciate you being able, especially as a doctor, right, to be able to see the whole person.
Hmm. Absolutely. I mean, there's no other way. Unfortunately, in medicine, we silo organ parts, right? By
Yes.
design, right? Like you can't know everything about the kidney as a gynecologist.
Right.
So I need to send you over to my nephrology colleagues because they're going to know every single thing, but they don't want to deal with the uterus. So I get it, right?
Right.
So we have our areas of specialty, but I really think it is as somebody who's putting myself on the front lines of caring for this population to understand I don't know what I don't know, and I know when to pull in my colleagues. In fact, I was just on a panel 2 days ago, and the panel was me, a nutritionist, a pelvic floor physical therapist, and a mental health therapist.
Sounds about right.
Sounds about. I'm like,
That's the team right
there's your
there.
squad, there's your team. Like when you're going through this, and I really think it was important for the audience to see that it's not just about hormone therapy because that's all the
Mhm.
rage now, right? Like I've been in this space for over a decade plus, and everybody's like, get on this, get on that, but you still haven't changed your circumstances.
Right.
You still haven't changed how you feel in your household. You still haven't changed how you feel about yourself as a person at this place of midlife where you're like, did I do enough? Have I done it? Have I, when you're
Hmm.
just like, just challenging yourself to say, who am I right now? There's a lot of grief. That's what one of the therapists said. And I was like, I say that all the time. There's a lot of grief that
Hmm.
happens during this transition of what was and some kind
Mm.
of like fear of what will be.
Hmm.
And so if you're only addressing the physiology, which is important, right? But if you're only addressing that, I feel like you're just band-aiding like this very natural transformation that's occurring.
Listen, I need to be real with you for a second. You're here listening to this episode. Maybe you're not alone. You feeling seen. And girl, that's beautiful. But if you're like most of my listeners, you're going to finish this episode. You're going to feel all inspired for about 10 minutes and then go right back to your regular life where you're still putting everyone first. I get it. I've been there. But here's what I've learned: the gap between knowing what you need to do and actually doing it is where transformation lives. Now, if you're tired of just consuming content about self care and you're ready to start practicing it, not tomorrow, not next week, but starting today, I created something specifically for you. It's called the 7 Day Self Care Reset, and it's exactly what it sounds like: 7 days of simple, actionable steps that help you move from thinking about prioritizing yourself to actually doing it. No overwhelm, no complicated systems, just practical tools that work with your real life. You'll get permission to put yourself first, learn to recognize those inherited patterns that keep you stuck, and discover what your authentic desires actually are underneath all the expectations. This isn't about adding more to your plate. I'm not going to do that to you. It's about finally honoring what's already on it, starting with you. Ready to stop listening and start living? Visit javerywellness.com/reset. That's RESET. And let's do this work together. Because the woman who just listens and the woman who actually takes action, they live completely different lives. Now, back to the episode.
Mm. Oh my goodness. So I think about when I went to, my mom has been asking me about menopause and this, that, and the other. And I went to a workshop
Yes.
when I was at the conference, and I realized all the symptoms, right? Like you said, we only hear about, oh, the hot flashes and, the moodiness or whatever. But that list, it had to be like 30, 40 symptoms, and
Hmm.
then she said there was more. And
Hmm.
as a therapist, the more I read the list, I'm like, that could show up as absolutely anything that we could diagnose:
Yes.
depression, anxiety, bipolar. You might
Hmm.
even be a little schizophrenic
Right.
sometimes with the
Yeah.
mood or whatnot, right? So how do people, outside of saying I feel crazy, because that's usually
Mhm.
I'm losing my mind, I feel crazy,
Mm.
how does someone begin to know that they are entering into that space?
That's a great question. And you're right. So I'm gonna get a little nerdy out a little bit,
Nerd
just a little
out,
bit.
nerd out.
So when we're looking at menopause, the median age of menopause is 51, right?
Okay.
The transition to getting there on average is about 4 years on the front end and 1 year on the back end. And that's what we call the perimenopause, right? It's kind of like the shoulders around the menopause.
Mhm.
Menopause is defined as 12 months of no menstrual bleeding. It's actually a clinical definition. So when I hear patients like, well, I want to get my labs checked. Yeah, there's some labs that are suggestive of menopause, but if you're having regular menstrual cycles, your labs are really not going to be helpful.
Mhm.
So that's when we really focus on symptoms.
Mhm.
Perimenopause is broken up as early peri and late peri. Late peri is a little bit more straightforward because it is tied to the menstrual cycle.
Mhm.
It's when you've skipped your menstrual cycle for greater than 60 days. So it's like two missed cycles. That's
Mhm.
considered late peri. And that's when you get more of like the typical menopausal symptoms that you think of, maybe a little bit of dryness vaginally, the hot flashes, the night sweats, the sleep disruption, that sort of thing. That's when you start seeing those symptoms. Early, it's not as straightforward.
Right.
You might get some cycle variability. Most people will experience that their cycles are getting closer together, and then they start spacing out again. And that's when you're starting to see some subtle changes like, my knees hurt. Like, what's that about?
Mhm.
Or I know my period's due to come, and yeah, I get a little PMS, but I'm like ragey. Like
Mhm.
I give this example, I give my personal examples. Like I remember raging, and it was almost like I was above my head with some popcorn, like, girl, you going off right now. I don't know what's wrong with you. And I remember having this experience, like, why are you raging like this? Like,
Mhm.
but I couldn't help it, right? And so a lot of patients are like, I feel so out of control. My
Right.
PMS, and that's when we're starting to see the progesterone levels are starting to fall, right? So that's
Mhm.
impacting that serotonin release in that luteal phase. And we're starting to see
Mhm.
more of those mood symptoms or my sleep is just not as great as it used to be. Like I'm waking up in the middle of the night and it's very subtle, or my joints are really kind of like achy. I don't know what that's about. Or even like libido, like, I mean, I'm not even really into it. I mean, if you
Right.
ask me, sure, but like, ooh, it's not even a thing. And I'm not just talking about like libido ish. Like, I don't even want to like master it. I don't want to do anything.
Mhm.
Like, I have no interest. We start seeing that a little bit earlier on. And that's what makes it really tricky. And it makes it tricky because guess what? Life, when it lifes, it can impact all of those
Yeah.
different things. And
Mhm.
that is the challenge when you are caring for people, especially in the early perimenopause, because it's not always strictly hormonal, right? I
Mhm.
think that that exacerbates it a little bit,
Yeah.
but it's really multifactorial in how we're experiencing. For example, I have people say, my sleep is just terrible. And then when I ask them, well, tell me about your sleep, they're stressed. So they go to bed and their mind is racing and they have a lot of thoughts about all the things, the kids, the parents, the job, all of these things. Then they're really having trouble sleeping, like they can't really sleep. And then the next day they're like, I got brain fog, their concentration is shot.
Mm.
Well, that's telling me, I mean, other than doing some lab studies and things like that for other things, but it's like we need kind of like a multi-pronged approach
Yeah.
because I can give you all the hormone in the world, right? But
Mhm.
it's not going to fix all that stress you have.
Right.
It's not going to fix that. And so I think for so many people, we really underestimate how much stress we endure and
Mhm.
how that's just not normal.
Mhm.
It's just not normal. Like we think that juggling 50, 11 things is normal. It's not. And my husband tells me all the time, he's like, we have the same, think of evolution. We have the same bodies that were created 30 years ago, right?
Yeah.
I mean, we're
Yeah.
living longer and things like that. But even if you just take 20 years ago, we are living pretty much in the same bodies. You know what happened 20 years ago? The first iPhone, the first smartphone,
That,
right? Now we're getting all of this input.
yeah.
Now
Yeah.
the body has not evolved, right? Like when we're thinking about evolution, we talk about tens of thousands of years. So we are still living in bodies that haven't really like physically adjusted to those like stress responses and things like that that these little devices give us, or knowing everything all at once.
Mm,
And I
yes.
think that we're really underestimating just how profound our world has on all of these other things, and sometimes it's not always hormones, but hormones will definitely make it worse.
Okay. So then everyone's question is going to be, Taniqua, what am I supposed to do about this? How do I stop waking up at 3 o'clock in the morning? How do I stop
Yeah.
raging out? Like, how do I
Mhm.
get better sex if I'm, dealing with dryness? Like, how do
Mhm.
I deal if I'm going to spend 5, 6, 7, some people spend years in this space?
Mhm.
How do I have a decent quality of life?
Yeah, that's such a great question. The first thing is honoring that you're not broken.
Mm.
There's a lot of grief that comes like when you're starting, your body physically changes, right?
Yeah.
Like I joke, I'm like, I weigh just as much as I did, but oh, I got a little pot belly.
Yeah.
Like the
Yeah.
weight redistribution is occurring. And it's really disarming, right? Like you're just like,
Hmm.
I don't feel like I'm in control anymore. And in a world that feels like it's out of control, when you no longer feel internally in control, that
Hmm.
could be really, really hard. And so there is that grief that goes along with like, I don't know if I'm ever going to be that person ever again
Right.
because you feel different. And
Oh.
so really realizing that this is like really reframing it a little bit to say this is a natural process, and I have the ability to really shape what that process is going to look like because you do.
Hmm.
Okay. So that's the first thing that I really want when people come to me, a lot of women apologize a lot. They're like, I'm just so sorry. Like, what you sorry for? Right.
Right.
Like it's a lot, and I get it. There are a lot of pressures on us to always like get it right, have it together, and so that's the first
Hmm.
thing. Like you're not broken. Come to your perimenopausal menopausal journey knowing that. The second thing is make sure you are a savvy consumer.
Hmm.
Remember, I just talked about we had a whole panel of doctor, all these things. You need a squad. Now think about it.
Mhm.
We do this for pregnancy. We do this for puberty. When we think of these big, what we call neuroendocrine transitions, you have your pediatrician, you have the school counselor, you might have the
Mhm.
sports coach. Whether you think of it or like it or not, these are your teens, especially, and then, I work with teen girls. These are their care team members, right?
The
And
wellness
so
team,
yeah,
yeah.
it's the wellness team. And it looks a little different, right? You have the
Hmm.
school counselor, like, or the guidance counselor, the school counselor, you have the pediatrician, you have the parent,
Hmm.
right?
Hmm.
When you go through menopause, you don't have any, right? And
Right.
then you have, like, if they're in extracurricular, you have that mentor, you have that coach,
Hmm.
you have a team wrapped around them while they're going through this pregnancy. You have the physician, you might have the office nurse, you have the whole squad and the family giving the baby shower, the gender reveals,
Yeah.
you have the doulas, you have all of these levels again of support. And then when you get to menopause,
You're all alone, like
you're all
silo.
alone. You're siloed, you're all alone, and you think one visit at the gynecologist or your internal medicine doctor is supposed to be good because they told you come once a year because it's included in your insurance. No. So you have to be really savvy, understanding that this is another reproductive transition. This is another
Mhm.
neuroendocrine transition that has long lasting consequences to how you're going to live the last third of your life. What are your bones going to look like? What is your brain going to look like? What is your heart going to look like? So that savviness is important. And that comes from one, community,
Mhm.
right? Being in community and hearing the stories of other women who are also journeying through this transition so that
Mhm.
you don't feel so isolated, so that your symptoms don't seem so crazy,
Right.
right? Like someone said, my ear was itching. Now I gotta tell you, if you look on the list, it's on the list. You get itchy ears, right? I don't see that a lot, but if one day you had itchy ear, like you didn't have itchy ears, and the next day, not only do you have itchy ears and you're waking up in the middle of the night with sweats, guess what? You're probably menopausal or in that perimenopausal
Mhm.
transition. So that's that first thing, community, being open and sharing. And in fact, there are some studies that actually show when women share their symptoms,
Mhm.
right? They actually cope with them better.
Of course, that makes I'm a therapist. I cannot say that that makes perfect sense.
Right. You don't feel isolated in that journey. So that's the first thing. Second thing, really, I want people to come to this menopausal journey seeing it as a journey, right? You
Mhm.
going cross country, you get in that car, you stopping off at all the landmarks, you taking pictures, you stopping to eat, to rest, all of these things. Menopause, you can't go from point A to point B. It is a journey. And so, really seeing that care team, that partnering, that community as being a part of that journey over time. So, one of the things that is really frustrating in practice is that we do tell people, oh, go to your gynecologist one time a year, right? Like you get your pap test, things like that. That's not the time to actually talk about your menopause.
Mm. Because
Your
they got
doctor,
one job.
they it's pap test. And
Yes.
that's it. Not only are they not compensated for talking about the pap test in some cases, but it's just not enough time. And
Right.
so I tell people, like, no, this needs to be a separate part of the visit. When you go to the pediatrician, if your child is sick or if your child has another diagnosis, you're going there. Menopause, we're gonna treat it like it needs some special attention.
Yeah. Yeah.
So yeah, and so you're going to want to engage your care team at different points along the journey as needed. And sometimes you'll need them less, sometimes you'll need them more, but understanding that it's not a one and done thing, right? It's
Mhm.
not that, because even as you go through the journey, your needs will change,
Right.
right? When you're early perimenopause versus late perimenopause, it's not the same rodeo. And so you really have to see it as this journey that you're on and really partner with your care team along the way.
Okay, so I know you probably know what the next question is. So we've talked about we need this wonderful care team.
Mhm,
However, Taniqua, we know that the wonderful care team that we would need, especially as Black women,
mhm,
can cost a little bit. And
mhm,
so if someone is like, okay, I would love to have this, but I have this type of insurance, or
mhm,
I just lost my job because
mhm.
everyone's getting laid off. Like
Yeah.
how am I supposed to afford this when
Mhm,
I am literally in survival mode? I don't have time to figure out how to pay somebody that's not on
mhm.
my insurance.
Yes. So if you have insurance, there is a website called menopause.org. And you can actually find clinicians who are like versed in menopause, right? They went through the
Mhm.
same kind of training and certifications that I went through to be a certified menopause specialist through the Menopause Society. And it will tell you whether or not they take insurance.
Mhm.
Right. So that's the first thing. So get somebody that's knowledgeable and they are out there. They are out there. You see that sometimes they're at that big health center, sometimes they're in private practice. They are out there. Even in my own practice, I do provide telemedicine consultations, and while it's a cash pay, I give super bills. And so my patients will then
Mhm.
reimburse through their insurance. And I've gotten like greater than 50% reimbursement for patients, right? And so
Mhm.
that's something that you can do. Sometimes you have to be clever about it or use your HSA dollars or things like that.
Yes.
That's the first thing. The second thing, I always see information as power.
Mhm.
So, for example, we know that there is a fat distribution that happens in perimenopause.
Mhm.
We know that as estrogen decline, insulin resistance increases. We know that cortisol goes up. We know all of that works to give us increased abdominal fat. There is like
Mhm.
really a literal restructuring physically in the body. And that can have some long-term consequences. So understanding that and understanding, well, what can I do to mitigate that through diet, exercise, things like that?
Right.
Go for the consultation one time. There are nutritionists that take insurance.
Okay.
You have to be a little savvy in terms of finding it,
Right.
but they do exist. Un- Go to I have a wonderful colleague who's a health coach. She's not a dietitian, but she's a health coach, and she only focuses on menopause. And she
Mhm.
provides so much education, and she has like low-cost memberships where people can like join. And
Mhm.
if they can't join, she has a lot of free resources.
Right.
And then we do what I said before, step 1, you get your community.
Mhm.
You get your community and you share and you say, this is what I'm learning. This is what I'm learning. Let's put this together so that we're on this journey together.
Yeah.
And in that is a good starting place. It really, really is a good starting place for my patients who have sexual health needs. I always like them to see a pelvic floor physical therapist.
Yes, me too.
Yeah, and sometimes they're like, but I'm not having pain with sex. And I'm like, but you're telling me that your orgasm response. I want to know if your pelvic floor muscles are weak, right? Because that's
Right.
part of so go for this assessment. And I will tell you, while some practices are cash pay, you ask your clinician, like, can you refer me to a place where is it?
Right.
And they will take insurance. And they will take insurance, right?
Mhm.
We have to ask the question,
Right.
right? We have to ask the question, but also we also don't have to be afraid to invest in our health.
Yeah. Yeah,
And
that
I get
right
it.
there. I
I
me
get it,
too.
right? Like I'm speaking from a very privileged place because
Right.
I also have a cash pay practice, right? I get it. But I also see us make decisions around other things
Mhm.
and leave ourselves last in terms of our health
Always.
and leave
Always.
ourselves last. Like
Mhm.
I joke, I have kids in track, volleyball,
Women, baseball, golf.
but don't ask me when's the last time, well, you can't see my toes that I even got a pedicure. I could grate some cheese on the back of this heel that I got right now. You know what I mean?
Yep.
And so I always say like, and sometimes these visits are one-offs, right? Like you might go for the information and then you just take it in
Mhm.
and really sharing those resources. But there are opportunities out there and we have to say, I'm going to invest in me right now because I will tell you, you are aware I had a caregiver story for the
Mhm.
ages. And if
Mhm.
we don't take care of ourselves, what our last like thriving years can look like can
Mhm.
be pretty devastating for our families and for ourselves.
Yeah, yeah. So it sounds like community is the thing, which, we are very aligned because I
Hmm.
have, I built my practice on every area you need help. I got you. We got the
Right.
maternal, we got the couples, we've got the grief. And I think being able to not gatekeep, right? Like you said,
Mm-hmm.
just ask the question. You can't assume that someone's not going to be able to help you, and you have to put the pride and the ego aside, right?
Yes.
It's okay for you to say, hey, Dr. Taniqua, I can't pay that price, but where can you send me? 9 times out of 10, they see the price on your website and they're like,
Mhm.
oh, well, I can't go to her. But like,
Exactly.
we're not just sitting here in this little box. We're
Hmm.
building connections with people because we are aware that there are people out there that cannot this. So I make sure that I
Yes.
have somewhere that I trust for you to go.
Hmm. And you know what's so funny that you say that? I do have people that will reach out and they will say, listen, like, I can't see you, but is there somebody? And you know what I do? I was like, book an appointment. I got you.
See them.
Like, I mean, because, right? Because I mean, because we're also heart led and community
right,
led. And so there
right.
is a certain part of the practice that, I mean, I believe in energy too, right? Like all
Hmm.
of that energetic, like you need help and you're asking for it. And
Right.
I have what you need. And it's
Yeah.
not always about the cash. Now, you can't have a mission without money. So we'll say that.
Right.
But if you're reaching out and you're taking that step to ask, yeah, come, let's just hop on a call. I do this all the time. Like,
Mhm.
and I'm not just talking about for like menopause. I'm just talking about like building businesses, life, things like that. Let's schedule an hour. Let's just talk. And I just pour into that person. And sometimes I have to give the disclaimer because like you're not officially my patient, blah, 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 or whatever
Yeah.
it is. But I'm going to give you advice to equip you so that when you do go to your gynecologist, I'm going to give you strategy. I'm going to put you on game.
Yeah.
This is how they're going to bill it. This is how they're going to say it. This is what you need to say when you call the front desk. Like
Yeah.
I'm going to give you the intel and the tools so that when you do go to that visit, you're going to be really prepped. And sometimes you're like you said, we just have to ask. But
Hmm.
I get it. I remember when I was training for my coaching, one of the things, and we were learning sales, one of the things that my coach said, she said, ask her, what does she want? She said, no one asks Black women what they want. Right. And
Mm.
so when I think about that, I know why they don't ask because nobody's asking them about what it is
Yeah.
that they want. No
Yeah.
one's really like showing up and caring for them. You hear me on here. I'm saying you're going to reach out to me. You have questions. I always try to get people to where they need to go,
Yeah.
even if it's not with me. So just same as you.
Hmm. Yeah, absolutely. And that's crazy that you say that because when they come to us, I'm like, what do you want? What is it you want so that I can put you in the right direction?
Mhm.
And 9 times out of 10, they don't
They
know.
don't know. Mm-mm.
They
Because
have
nobody's
no
asked
clue.
us. Nobody's asked us. Or they're told, or we're kind of taught that whatever it is that we want is too big.
Yes.
Hmm.
Yes. Ugh, all of the things, all of the things. So for you, you have free resources. What are your free resources?
My free resources, well, I'll put them back up. But before I became a caregiver to my mom, and she passed away this year, and I'm still kind of like not back into a groove. I used to have
Yeah.
revivals. You were on one of my
Yes.
revivals, which
Yes.
was so fun. And my business is called, well, will be Revival Women's Health, which is the brick and mortar, but I do Revival Telemedicine where I do my perimenopausal consultations, my menopausal consultations, and recognizing that not everybody could have access to me in
Hmm.
that like high touch concierge space. I was hosting quarterly revivals where
Yes.
basically I was taking a big topic in menopause and I actually would split it. I would like talk about it from a physiology standpoint. And then the next, so
Bring
sexual
an
health was the one that we talked
expert.
about.
Yeah.
And then I bring an expert to kind of talk
Hmm.
about it. So we lean into it. So you get that baseline education
Hmm.
and then you get to talk with the expert. And I felt like that was such an important piece for the community because I don't know what I don't know. So I was sitting
Right.
there too with popcorn, like, oh, girl, tell me more, you know? And so that will be coming back to the platform. I felt like in the spirit of community and
Hmm.
bringing people together and asking questions and things like that, that was something that was super, super important. And
Hmm.
so it's been on hiatus for the last year.
Yeah.
It's been on hiatus for the last year, but that's where I'm hoping to come back. And then also following me on socials. And I put out content that talks a little about building the practice, but also debunking some of the things. Like I just had a story. I was seeing so much about like seeing so much as it related to diet and seeing so much as related to like all these things. I feel like menopause has become this marketplace,
Oh, it has.
and I don't think it's always speaking to us either. And so I'll put content there, and then of course, like Midlife Revival, the podcast,
Mhm.
lots of content. I have over
Yes.
50 episodes there, and so talking about sexual health, I have illustrious guests on the
Yeah.
podcast. That's a ton of free content where I'm really telling you, okay, this is the reason why you can learn so much, so much, and really from a place of listen, you're not going through this journey in isolation, right? Like we
Mhm.
are in midlife, and so all the things are coming for us at this time. So the podcast acknowledges that and breaks down that physiology and treatment and things like that. So really, really good resource as well.
So, as far as it pertains, we've talked about like the person, right? The actual person. What does it look like for that person to be able to communicate what is going on without knowing what's really going
Mm.
on to a partner or to family, right? Because
Mm.
really, the family just thinks you're losing your
Mhm.
mind. You're mean,
Mhm.
you're angry, you can't remember anything, you're becoming
Mhm.
unreliable.
Mhm.
You've got the house freezing.
Mhm.
So, how do
Yeah.
you have conversations without having real verbiage?
Yes. So I'm going to go back to what I said before. Really, really work on that shame piece. Because when you
Mm,
don't know what's happening and you kind of get into that shame place, a couple of things happen. You either withdraw, so you don't communicate, or you become really defensive, right? And
mhm.
that's just kind of like your evolutionary way of dealing with the world.
Right.
And so, really kind of going inward and saying, what am I feeling right now?
Mhm.
I midlife coach. I always have a feelings wheel. Like name it. Name what it is. Is it embarrassment? Is it shame? Like just name it first for yourself
Mhm.
and process that, right? And process it with someone that you trust. If you have a therapist, process it with them because until you can get past whatever that thing is, because it starts with you first. Yeah, the family, they'll be fine, right? Like the family's dealing with it. But if you're not feeling good about you in this transition and you feel like I use the word disembodied in this transition, and you
Mhm.
feel like you don't have any agency in this transition, you're not going to be able to communicate to your family with not only what's going on, but what you need, right?
Mhm.
So that's the first. So the first thing is really go inward and name how you feel about this transition. And you can go to feel I don't know if it's feelingswheel.com or whatever it is, but like really kind of name it and process those feelings. Again, that grief that comes up with this change
Yeah.
with someone that you trust. So that's the first thing. Once you do that, the words that I use in my own life, okay, on my own life, is I looked at my husband and I said, I don't feel well.
Mm.
I knew I was ragey. I knew I wasn't feeling well. I knew I was like, ugh, right? Like I'm on my phone and I'm looking at like little apartments. Like, I wonder if I could get like a little escape for the weekend. You know what I mean? Because you just didn't want to deal. And I was confusing that with maybe grief over my mom passing and all of the responsibilities that I had. And I was like, but this feels different, right?
Mhm.
Like I can compartmentalize that, but this just feels like all encompassing. And I remember when I finally was like, I think this is perimenopause. And I like
Mhm.
went through, wow, like I felt stupid. So my feeling wheel was embarrassment towards myself.
Right.
Nobody
I'm
else
the
knew.
doctor, and look at me. I don't
This
even
is
know
what
what
I
I'm going
do.
through.
I had the whole prescription and there was something in me saying, I don't know if I could like make the decision to actually start. Right? Like, what does that
Yeah.
mean that I'm making the decision to start hormone therapy? Is it too soon? Is it not? And so finally, when it occurred to me, like, oh, these knees, the way these knees set up these days, where I step out of the bed and I just feel really achy, the
Mhm.
fact that there's dryness that's
Yeah.
never been an issue, right? My mood is all over the place. I was like, here we are. And I felt embarrassed that I didn't recognize the signs, right?
Mhm.
So once I processed that and actually reframed it and say, if I feel embarrassed or if I couldn't recognize the sign and I couldn't make that distinction for myself that this is where I was, I can't imagine what it's like for my patients. So tell that story,
Yeah.
right? So tell that woman that yeah, you don't know and you feel crazy for not knowing, right? But so did I. And this is what I do for a
Right.
living. So it's very hard. It's very hard. So that's that first thing. Process that. Secondly, say it out loud to your people like, I'm not feeling well. I think I'm perimenopausal. I think I'm going through some hormonal changes right now.
Mhm.
And pulling those resources, there's so many resources now. Menopause.org, they have some resources. That's usually where I send folks. But Black Girl's Guide to Menopause is also wonderful. There's another
Mhm.
one in the UK, I believe it's Black Whilst Menopause. And so
Mm.
there are all of these resources that you can like educate yourself and like bring it to your family. Like, look, these are the things that apparently I'm going through. But here's the caveat to that. Ask yourself if you want to get better,
Yeah.
right? Because sometimes we're like, I'm going through this thing, like I'm not feeling what I'm going through, but then what do we do to maybe feel better?
Yes.
That's going to be the third thing. What action are you going to take around feeling better? Not just for your family, but for yourself,
Right.
right? Ask for a little bit of grace, especially like, for example, if you're having vaginal dryness or libido issues, you're not feeling well. It might take you a while if you opt for therapy to start feeling. Communicate with your partners like, listen, I might need a little bit more effort. I might need a little
Yeah.
bit more work. It ain't you, it's this body that's changing right now.
Mhm.
But showing that, like, and demonstrating to your family that you want to feel better and then taking those steps to do so.
Mm. All the things,
All
man,
of this
all the things.
stuff.
I remember you like, I don't know if you posted it somewhere. We had a conversation. You were like, she's here. This is it.
This is it. And I was sensitive because my mood, like I noticed that like in that luteal phase, I was like, ooh, I'm getting like I burst into tears, like, ah. And I remember being like, girl, you tripping. My husband was like, girl, you tripping. But literally was like, I don't know why I'm crying. I felt overwhelmed by business and things like that. But
Yeah,
usually I can manage that. Like, right? It's just kind of like keep it moving, girl. But
right.
there was this overwhelming sense of and I couldn't stop it from happening. And again, it was like I had a little picture above my head. I was popping popcorn, like, girl, you tripping. And it was this outer body experience. And when I tell this story, about feeling like I was out of my body, my patients are like, "That's it.
Oh, wow.
That's it." I'm like, I
Yeah.
can't stop the rage. I can't stop the crying. I can't stop the sadness. I can't stop the anxiety. And I, in my right mind, know that because sometimes, like with like anxiety or depression, like you don't know.
Mhm. Right.
You don't know. This is
Mhm.
just your lived experience. Like you're
Yeah.
living and you're like, this is, but there's something that changes. It's like, no, 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 this is not normal for me. I know my normal. I know my baseline anxious. This
Right.
ain't it. You know?
Right.
And to me, that's really empowering because you might actually be cracking the code on your perimenopause. You may not have any other symptoms except for those subtle changes in the beginning.
Yeah. And I think knowing, right, like as a professional, as a therapist, I know people come to talk about things and they're like, I'm anxious, I'm depressed, this, that, and the other. I'm always like, especially in an age bracket,
Mhm,
because most of my clients are, between late 30s into their
mhm,
50s. Have you gone to go talk to your doctor?
mhm.
Like, I need you to go talk to your doctor because, yes, you could be depressed or you could be going through perimenopause. Like, there
Right.
are so many little nuanced things where it could be this or it could not. And so I know my lane. We need to go ahead and start ruling things out.
Right. Right.
Absolutely.
Especially if it's that new stuff. Like the classic is I have a history of depression or I have a history of
Mm-hmm.
anxiety. I've had treatment for that. I have all the tools, but they're not working anymore. Right? And those patients have so much insight into what's normal and not normal for them. And as a clinician, it's my job to listen,
Mm-hmm.
right? Like I'm like, you live in your body. And if you're telling me that 6 months ago, the things that used to work to help with what your already existing anxiety or depression is not working anymore, that's telling me something's shifting in terms of hormonally.
Mm. This was such a good conversation. I think you gave a lot of information. I think for the listener, this might be a little overwhelming. I think it will be overwhelming because there's answers. I think,
Oh,
right,
tell
like
me more.
I really think that people are gonna leave this episode and be like, shit, now that I have answers, now I can go do something about it. But
Mhm,
it's, there's also the grief of like,
mhm.
oh, but there are people out there, and I've been dealing with this so long, and I've been thinking that something is wrong with me. And oh my gosh, there are actual answers.
There are actual answers. Yeah. That's
And
why I always start out like that grief piece, the
hmm
brokenness piece, like what's wrong with me? Why can't I get it together? I'm losing my edge. I'm not sexy anymore. Like look at my body. Like it is so overwhelmingly deep how profound the life society, what does this mean for me in terms of like my value and my usefulness to
yes.
society? It's really remarkable. I'm happy at the renaissance of menopause and the
hmm
conversation. I think As someone who's been in this space, I feel like the pendulum has swung the other way.
Absolutely.
And I'm happy that there is a wave of interest in learning more about menopause. My pause, though, is that I think it is very targeted to certain demographics that
Hmm.
are not very inclusive.
Hmm.
And I feel like we've now taken menopause and made it a marketplace where we're telling women you should menopause in this way. And if you're not menopausing in this way, you're not doing it right. And that is
Dang, I didn't think about that. That sucks. They always take something and put it in a box.
yeah, like, right? Like, so I'll have patients now that come to me with a list and they're like, I think I need you to be on all of these things. And I always take a step back and say, well, tell me what your goals are. Like, what do you want life to look like?
Hmm.
Like, what's important to you right now? What symptoms are really preventing you from being the best version of you?
Hmm.
And then when we have that conversation, half the things on the list you don't need. We need to
Right.
prioritize this. And so there's just so much information, but not a lot of understanding. And unfortunately, I feel like sometimes our healthcare models don't really give time for our patients to really have an opportunity to really get to the heart of what they need.
I love that. And so, for the listener who is like, "Ah, there are solutions," what does she do next? What should she do next with all of this information you've given her?
Yes. So if you feel like you are in that perimenopausal journey, you starting to notice those changes. Remember, we defined that early perimenopause as well as that late perimenopause. One of the first things that I would do is really educate yourself. There are some great books out there that really give the lay of the land of what menopause is, what's happening in your body. I think that that can be really empowering. We know that when you're educated about it, it's no longer scary, right? Like when you
Mhm.
have that hot flash, you're like, okay, I'm
Yep.
having this hot flash because my temperature regulation zone, blah, 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 blah,
Mhm.
right? And so it's not like, oh my gosh, I'm not in control anymore. You take back power in those moments through education. And so there are a host of different books out there. I don't have a favorite, to be honest. There's so many. And so I recommend people read reviews and to see, and that really provides like a foundation of what is happening in the body. There are podcasts. You can listen to
Mhm.
Midlife Revival podcasts to learn different things and how different professionals can show up and help you be part of your team. I think that
Mhm.
that's also important. So that's the first thing. The second thing I would say is when you schedule that visit with your clinician, schedule your first visit just to talk about menopause. When you
Mhm.
call the office and they say, what's the reason for your appointment? I would like to talk about menopausal symptoms. Why? That doctor or that nurse practitioner or that PA, whoever you're seeing, they're going to look and they're going to say, oh, this is a menopause visit.
Mhm.
Because what happens is if you say this is my annual exam, and I acknowledge that you're going to probably have to pay some copay or something like that
Right.
for that visit. But if they say, well, woman exam, and they're coming in very laser focused to do that type of exam, which believe it or not, from an insurance and a billing code, like there are literally
Yeah.
checklist things
Yeah.
that you have to accomplish to get paid.
Yep.
And if you're missing any of those elements, your doctor doesn't get paid. And so now if you come in and it's really a menopause visit, they're not going to some would actually have you reschedule or they'll convert your visit. And if they actually there's a whole bunch of nuanced insurance billing, but like you might end up
I
getting a surprise,
understand.
you might end up getting a surprise bill. So what I always recommend is let that first visit be actually to talk about your symptoms. And here's why. You schedule that first visit, right? You meet with them. Maybe you start therapy, maybe you don't. Maybe you have some time to think about it. Before you leave the office, see, I'm giving them the game. Before you leave the office, schedule your annual exam.
Mm.
Why? Because now in your annual exam, you're an established patient, so they tend to get in a little bit sooner than like a new patient. And if you started therapy and things are going well at your annual exam, you kind of are doing your follow up. So you're getting a twofer. Those visits, the doctors are okay with, right? Because
Mhm.
you're not actually going through treatment options. You're really just
Right.
kind of fine tuning what you're already on.
Right.
If there are changes that are made, have some understanding that you might have to come back for another visit just to kind of fine tune it. Again, it's a journey. You're getting in the car, you're taking that cross country trip, right? And those
Mhm.
needs are going to change over time. I liken it to, like I said, in a pregnancy where you have prenatal visits, it's like 10, 12 visits in that time. You're going to have
Yeah.
that expectation that while you're fine tuning, that you might need to be seen a little bit more frequently than you do now. And then if you don't like the person that you've seen, or if they tell you that hormone therapy is not safe, or you're not, whatever or I don't do hormone therapy if you're not at the menopause, be real picky and go find somebody else,
Yes, don't
because
stop.
that's not current literature. That's not true, right? Like that person does not read. And so, or they just don't have a comfort level to care for you, and you deserve to be cared for. And
Yeah.
so that's when you clock into the community and say, who did you see? This was my experience, didn't like it. Or I saw this person. Okay, let me try to get an appointment with them, and be an advocate for yourself.
I love that. So, for those that want to be in your world and work with you and things of that nature, what are they doing? Where are they going?
Yes. So right now, I provide telemedicine consultations for women in perimenopause. The website for that is revivaltelemedicine.com, where you can schedule a visit. And we spend an hour together just talking about what your needs are. If you need medications, we call it into your local pharmacy. If you want to think about it, we can schedule follow ups. We have a patient portal. It's me. I'd say it's a one woman show with an assistant. And so, literally, when you're sending a message, it's me. It's me. And I'm getting back to you in 24 hours. And so, in my old practice, the big old practice, like that wasn't really possible because of the volume of patients. So, it's a very small boutique practice where I'm seeing patients for consultations. In Q1 2026, born out of Revival, I had a lot of patients who said, I really like this model of care. I like that you can put me in touch with the pelvic floor physical therapist and the health coach and the nutritionist, that I've created in Revival this ecosystem
Mhm.
of your crew, the people who are going to get you through what you need to get through in your perimenopausal and menopausal journey. And so that is going to be the brick and mortar, more comprehensive midlife care practice. And
Mm,
so it's a membership based concierge practice. The website is joinrevival.co. That's joinrevival.co. The website is live. The links are not, because we are still putting those in, but the website is live if you want to get to know what Revival is all about, why we're doing this model of care, and see what we offer. But it's comprehensive GYN care, really focusing on your same demographic, those late 30-year-olds, all the way up to 65,
mhm,
right before 65. And that's where we're doing not just like preventive health, so GYN exams, we're doing contraception for that age demographic, we're doing hormone therapy, sexual health, weight management, all the whole nine yards.
mhm,
Everything that really, like, I really envision Revival Women's Health being the medical home for women in midlife,
mm,
where they come, they get their primary care services, they get their GYN, their hormonal services, but again, creating that ecosystem of specialists so that when they need something outside of that, they have a more effortless way to get there. Because if you are a patient and you're trying to navigate healthcare right now, if your doctor tells you make an appointment with the endocrinologist, or make an appointment for this, or make an appointment for that, it's hard to navigate.
mhm.
Really, really hard to navigate. And so we're hoping to take that out in the practice.
Oh, I love that. And I love that for you. And this was such a good conversation. Thank you so much. Y'all go
Always.
follow, stalk, go spend money, get the resources, all of the things.
I appreciate you.
You.
Thank you for, I'm so happy we were able to get together and do this. And I'm so happy that your listeners have you and they have
Oh,
your practice. And I've been able to watch the practice blossom and really be like, for you, like kind of the home, right? Like you have
yeah.
every type of therapy
Yeah.
that your people need. And so
Mm-hmm.
that's what we need. We need that central place for safety, right? To feel
Mm-hmm.
included and spoken to, and to feel held.
And that's a wrap on today's episode of Owning Pleasure as a Black Woman. If this conversation sparked something in you and you're ready to take action, don't let that inspiration fade by Monday morning. Visit www.jrewellness.com/reset and start your free 7-day self-care reset today. Because the woman who just listens and the woman who actually takes action, they live completely different lives. Talk to you next week. Bye.